PPE is my scene safe?
Scene is safe.
What is my mechanism of injury?
Blunt trauma to the head.
How many patients do I have?
1.
For this, I am gonna consider C-spine. I see a patient laying on the ground. He looks like he's in his 30s, and he looks pretty beat up in the head. Hi, I'm Jason. No response. Can you hear me? No response. You know what today is? No response. You know what the president is? No response. So I'm gonna go ahead and give this patient 0 A no's. They're not responsive. Why did they call? I can't ask the patient because they're unresponsive. So, Proctor, are there any apparent life threats?
No.
No life threats at the moment. Alright, I'm going to go ahead and open the patient's airway. Alright, so the airway is now open. I'm going to go ahead and measure the breaths per minute. Alright, Proctor, what is patient's breaths per minute?
26.
6 breaths per minute. Alright, I'm going to go ahead and give my patient oxygen. I'm going to do this via non-breather mask for 15 liters per minute. So I'm going to go ahead and do that. Proctor, is there any major bleeding going on?
Yes, on the back of the head.
Alright, I'm going to take my patient's radial pulse. Alright, Proctor, what's the pulse?
Rapid and weak. Bilaterally.
Alright, Proctor, what's my patient's skin color, temperature, and condition?
Cool, pale, and clammy.
Alright, I'm going to go ahead and make this patient a high priority and take him to the hospital for trauma. For sample history, I can't look into their allergies, know their medications, because they're unconscious, so I cannot ask them those questions. Medications, past medical history, such as surgeries, last oral or drink intake, or but I can assume, I'm just guessing off a guess, that events leading to this situation, he tripped on his way to his car, maybe. So I'm gonna assess that because he was bleeding from his head, it's a possible fracture to the skull. Other than that, based on everything I have here, I don't see, I mean, as far as that, Proctor, is there anything such as neck injury? Are there any neck injuries present?
No.
Chest?
No.
Pelvis?
No.
Nor groin?
No.
I'm going to go ahead and take my patient's blood pressure. Alright, Proctor, what's my patient's blood pressure?
186, 118.
Alright, now I'm going to take the pulse. Alright, Proctor, what's the pulse, current pulse?
58 beats per minute.
Beats per minute. Alright, I'm going to check the respiration quality. respiration and quality. So, alright, what's my respiration rate and then the quality?
26 breaths per minute, irregular.
Regular quality. And what's my oxygen levels in the room?
94% on room air.
94%. Alright, for this, I'm not going to give any secondary injuries. I can summarize that my patient has a fractured skull. They had a blood pressure of 186, 118, current pulse of 58 beats per minute, and they had a respiratory rate of 26 breaths per minute, and it was irregular. Their skin color was cool, pale, and clammy. I'm going to go ahead and continue supplying oxygen every 5 to 10 minutes while we transport. And that is my trauma